Welcome to Constructing the Carolinas, a show where we explore the growth of our communities, cities, and counties across North Carolina and figure out what's on the horizon. We are brought to you by Barnhill, which has been constructing the Carolinas since 1949. I'm your host, Valerie Bono, Director of Business Development. Today, we welcome Scott Senatore, Chief Philanthropy Officer at ECU Health Foundation. I've been impressed by how ECU Health Foundation drives community-focused healthcare development, so I wanted to get Scott in here to tell us all about the foundation's why and what impact it's had so far with the university students, the health system, and Eastern North Carolina as a whole. Scott has been all about community in his career, having served as the president of the Greenville-Pitt County Chamber of Commerce until he joined Vidant Health Foundation in 2016, which later became ECU Health Foundation. Its purpose statement is to give hope to Eastern North Carolina and beyond by inspiring philanthropy to improve health, education, and well-being.
And so what that means is, in a nutshell is that we're seeking donors and community members and businesses and foundations across the country, but more focused on maybe Eastern North Carolina and North Carolina, who have a passion for healthcare, have a passion for higher academics, who have a passion for ECU, have a passion for ECU Health. And we link those passions to those stakeholders, if you will, in support of the mission of what we do. And so from a health system perspective, we have ECU Health. We've got a system of care that has a little over 1,700 beds and an academic medical center with 2 campuses and a teaching hospital, the Brody School of Medicine, and 8 community hospitals in Eastern North Carolina, and a number of outpatient facilities and other clinics along Eastern North Carolina. And so the dollars that we raise go directly in support of that, if there's the healthcare focus for a stakeholder. And then we also support the health sciences campus of the university. So if there's someone that's interested more in the health sciences component of what we do, that's the Brody School of Medicine, the College of Nursing, the College of Allied Health Sciences, the School of Dental Medicine, and Loftus Library. So at the end of the day, our job is to link those people and their interests and their passions to either the health system or the health sciences campus of the university, or both. In some cases, there's people that like to support both, and that's what we're here to do.
Yeah, that seems like a really dynamic ecosystem, right? Mm-hmm. When you're partnering both with the university and the health side and aligning everything together. So you must be very busy as a chief philanthropy officer, to say the least.
Yes, there's never a dull moment. Every day is different. And one of my jobs, in addition to raising dollars, is to get to know the people that put those dollars to use, right? Because it's one thing to raise the dollars, and then the thing that we spend a lot of time on and are very passionate about is making sure that we understand how the dollars are going to be used. And so to do that, you're talking to professors and doctors and clinicians and executives and administrators. And so getting a chance to meet them and talk to them about how they bring everything to life is also another fascinating part of the job.
Yeah. So is that typically what a day in the life looks like for you in your role? Are you spending most of your time meeting people? Are you attending events? What does that look like?
Yeah, that and some other things. There's, like I said earlier, there's never every day is different, and that's a positive thing. But I think if I had to put sort of a day in the life of the chief philanthropy officer into some broad categories, one category would be just the management of the ECU Health Foundation. So my responsibility would include strategy planning and day-to-day operations and just oversight. And so all that comes with that, getting to work with the people on our team, getting to make sure that we put the plans in place that lead to success and raising dollars, and that we can then have the operational plan in place to execute the strategy. And so all that takes time and meetings and collaboration with the team. So there's that piece of it. And then there's the fundraising piece of it. And so meeting with donors and prospects and sharing the vision and understanding what it is that donors can support. And so that would be the bucket where that's sort of what I talked about earlier, meeting with the clinicians and the executives and the professors and the researchers and all the folks that bring everything to life and really or why we're in existence, talking to them to make sure that we've got everything we need to sort of link those passions in the appropriate way. And then there's the board management piece too. So the ECU Health Foundation has a board of a little over 40 people, and they do a great job. And those people are super invested in what we're doing and how we're doing it. And so the what comes with board management would be just the meeting structure and the committee structure and the governing boards and how all that works on an annual basis, and that takes a decent amount of time too. But the I think that all three of those together would probably make up in some form or fashion. I probably touch on one of those buckets on a daily basis. Some days there's more time spent than others, and there's some downtime in terms of board management. For example, if we've got a month where there's not as many meetings, then I can do more fundraising. Or if there's not, my time is not needed on the management side as much because the planning is in place and it's just a matter of execution, then I can do more fundraising.
Yes, you've got a lot of stakeholders that you're working with regularly, which is very impressive. I want to dial in a little bit deeper into some of the teams that you work with. So you've got a development team in particular, and I know you mentioned that there's a large presence in Eastern North Carolina, but can you share a little bit about how your foundation and development teams work within the communities to make sure that you're focusing on the broader needs within those communities?
Yeah, so the we have a team of about 30 individuals who are all skilled and passionate about what the ECU Health Foundation does. And there within then those teams, there are certain teams that have responsibility for our community hospitals, for example. So we've got 8 community hospitals, and each of those hospitals, although they're linked to the ECU health system, may have slightly different needs just based on how they operate and the kind of care that they offer in that particular area, because we are a health system and it's a hub and spoke model. And so we are efficient with how we deliver care, and what's at each facility is very strategic and purposeful. And so there are different needs at each community hospital. So when you're fundraising for one community hospital and then you move to the next, there may be a different menu of opportunity if you're talking to a donor, for example. And so we engage. I think you talked about this, Valerie, earlier about how it takes a lot of people, and I think that's exactly right. It takes a lot of people, and we're fortunate to have a lot of passionate volunteers and donors and stakeholders who have an interest in what we're doing and want to help. And so it takes engaging those folks and talking to them about what we're doing and how we're doing it, and then there's their desire to help us do those things and link us in the appropriate ways and the meaningful ways within each community to make sure that we're meeting that community's needs relative to their hospital. And so I think that's we always bring it back to the mission and to the hospital. And so our hospital team is in close contact with the county management of each of the where we have hospitals and the county managers of Eastern North Carolina to make sure that from a broad perspective that there's needs that the hospital is deploying resources and efforts to make sure that we're helping with. So it takes a lot of collaboration and to figure those things out. But I think we've got the model set up to where we can execute on that efficiently and successfully.
Yeah, I didn't realize that you're also being involved from a municipal level as well and getting city leaders involved with the foundation. That's great. And it makes sense, right? That you would, it takes a community to really address the needs of a community. So working with local officials seems to make sense. And it seems like it's critically important as well.
Yes.
Okay, wonderful. So the foundation has different causes, and I was looking at your website before we recorded. You've got the cancer care, heart and vascular services, children's health. So, in terms of fundraising and development efforts, can you give a little bit of some specific examples how you're prioritizing the needs? I know it's on a case by case basis with the different hospital, but can you tell us a little bit more about how you dial into those needs?
Sure. Yeah. So so it is a system of care, and so we're able to sort of raise dollars in support of things that would be system wide. And so one example of that would be just cancer care. And so there's a cancer care model in place for ECU Health, and the hub of that, the cancer care activities at the Eddie and Giles and Smith Tower in Greenville. However, each of our community hospitals is equipped to handle certain pieces of that care continuum. And then those patients only need to get to Greenville for more advanced treatment. And but then the goal is to get them back into their community hospital or the hospital closest to their home, just because when they're going through that, there's a lot of stress, and we feel that it's better for the patient to be able to have that care closer to home when possible. And so that's just an example of how we talk about from a fundraising perspective, how we can be most effective is when we can raise dollars that are beneficial to the health system as a whole in a particular area. And so cancer care is one of those. But I'm going to back up for a second. And when we talk about fundraising priorities now, and I think we're going to talk about this a little bit later, but through alignment and the creation of the ECU Health Foundation, there's two buckets that we fundraise in now, two broad categories. One is would be health care. And so that's all things health system and the community hospitals that we talked about and the cancer care. And then the other is health sciences, which would be more things that are traditional to higher academic fundraising, scholarships, research, faculty support, those types of things. And so we lean heavily on the executives and the administrators that sort of oversee all that to figure out, where there's need and where there's strategy from those two institutions, and then how we can sort of fit into that strategy to help them achieve what it is they're trying to achieve. And so, for example, the Eddie and Giles and Smith Tower, which is the hub of ECU Health's cancer care in Greenville, North Carolina. Before we set out on that journey to create that, cancer was one of the leading causes of death in Eastern North Carolina. And actually, the cancer cases were disproportionately higher in Eastern North Carolina than they were in the rest of the state. And just to bring those numbers close to home, 19 people were diagnosed every day and 8 passed away each day, from statistics that we gathered in Eastern North Carolina. So there was an epidemic of and cancer was an issue. And so one of the things that we learned was that it was an issue because there wasn't enough pre-screenings, there wasn't enough early detection types of things, there wasn't enough of those early preventative type of things that we had to complement what we could do from a cancer care perspective at the hospital. And so the Eddie and Giles and Smith Tower helped with all of that and created the hub, and then we enhanced the spokes to that hub and went and out and raised $50 million over the course of a 6 or 7 year period to help support that initiative. And just we opened in around 2018, and now we're in 2024, and we've seen the cancer cases decrease in our region 15%. So now we're back to the state average, which is still, from our perspective, not good enough, but it's trending in the right direction, and we want to get below that. So that's a good example of how because how we operate. So our team is not in the business of figuring out what it is the health system should do, because there are people at the health system that have those credentials and have that experience. Our job is to listen to what the priorities are based on the need that they're seeing. And then we deploy resources and efforts to help them fundraise for those things over the course of time. And in some cases, some projects are bigger than others, some are smaller in nature, but that's sort of how we operate on a day-to-day basis.
Yeah, well, congratulations on helping reduce and see the trend in a better direction by 15%. I know that's not it puts you at the state average, right? But I mean, that's a huge difference in a very short amount of time. And I had no idea that Eastern North Carolina was behind that much. That's really eye opening. And I don't think our listeners would know that as well. So thank you for sharing that.
You're welcome. Yeah, I think that one thing to from a healthcare perspective to keep in mind to just to piggyback on that is that this is one of the you'll hear executives at the health system say that Eastern North Carolina is one of the hardest populations to take
Mm,
care of. There's just a lot of disease in this area, and that was shown in those cancer care statistics. And so that's also a good example of how we're making such a big difference in from a mission perspective and the health, education, and well-being of this area through initiatives like the Eddie Andrelson Smith Cancer Tower.
absolutely. And then I also want to pick up on something else you said. You mentioned the health sciences, right? And from studies I've heard, especially since COVID, right, there's been shortages in nursing and in the medical field. So I would imagine that some of the scholarships and funds raised from the foundation is certainly going to towards supporting the workforce challenges, right, and helping with educators in the health science space.
Yes, so yeah, that's and now that's under the ECU Health Foundation's sort of scope of work as well as to help with that. And so on that side of our shop, the dollars go towards exactly to things exactly like what you just said, scholarships. And so, and I think the Brody School of Medicine and the College of Nursing and the School of Dental Medicine, the College of Allied Health Sciences are all just really great assets because their whole purpose is to try to get people to stay in Eastern North Carolina or the state of North Carolina and work in primary care. So there's primary care clinician shortages around the country, and that's no different in North Carolina. And so one of the ways in which we can help with that and get more people interested is in through scholarships, because if students were to get those scholarships, then they come out and graduate with less debt, and then they could work in some of these underserved areas or some of these uh, specialize in some of these things that maybe they wouldn't get paid as much as some other specialty areas, but they can do that because they don't have as much debt coming out of school. And so that's where I think the beauty of our model is, where we've got sort of a full array of opportunity for a donor or for a prospective donor. There are things that we're doing on the health system side in terms of capital projects like a cancer care, like I just talked about. And then there are things that we're doing on the academic side. So helping build pipeline and workforce development, helping get students in uh, the dollars into school, and then helping them with less debt once they graduate so that they can then serve the areas that our donors are very passionate about.
Yeah. I know we talked about on the healthcare side, right? A movement with trends going down to 15%. I'm curious if you have any specific examples on the healthcare side and then also on the academic side of maybe a story from a student who benefited from the foundation scholarships or just very specific examples of where it's made an impact both on the cancer and healthcare side as well as the academic side.
Yeah, there's lots of stories. I've got some data points too that I can share with you.
Yeah.
One story just recently, I was just talking to a group of R1 folks, and R1 is their first year of residency. So they've graduated medical school and doesn't necessarily have to be Brody School of Medicine. But in this particular case, this person did graduate Brody School of Medicine, and then he was in his residency program at ECU Health. So he got matched here. And I was sharing with them that the desire for us, um, to want them to stay and practice in Eastern North Carolina and work at ECU Health post residency, and that it's so important to us that the foundation is deployed in raising dollars for this, and that there are certain stipends available for folks that want to stay in Eastern North Carolina and work at ECU Health. And if you apply for these stipends and you get them, I think they're really beneficial to helping offset, some of the debt load that you may have if you're come out of school with a lot of debt, or help incentivize people to stay in this area who these people otherwise could go anywhere in the country. And this is not uncommon in this world to have these types of programs set up at health systems to recruit and retain clinicians. And that person was so impressed by that they have committed to work post residency at ECU Health, um, to care for the people of Eastern North Carolina and serve the mission of the health system. So there's examples like that where we're making a difference, where we're recruiting and retaining and saying that we want them to stay, and then not only saying that, but also having the resources to sort of support that. But so then, in addition to that, most of the graduates from Brody, the College of Nursing, College of Allied Health Sciences, and the School of Dental Medicine stay in North Carolina, and then also more specifically stay in Eastern North Carolina. And so, just in and of itself, being admitted to one of those four units, and then graduating from there, the likelihood that you're going to stay in Eastern North Carolina or the state of North Carolina is very high. And so that is serving the mission of the health sciences units at the university, because that's exactly what they're there to do.
Yeah. No, I love that. I think having those personal touch points with the students, right, where you're physically saying to them, we would love for you to stay in Eastern North Carolina, that has to resonate with them, right? And that has to have such significance to them, and give a sense of purpose for why they're doing what they're doing, but then also in turn keeping them local with their
Mhm.
roots, right? And I know certainly, so at Barnhill, we've got a lot of employees in Eastern North Carolina, and we have employees that their lives have been saved. They wouldn't be here to this day if they didn't get the treatment and the care that they've received from ECU Health. And I know that's a fact. Cannot say thank you enough for the care that your team gives to the people of Eastern North Carolina in particular.
Thank you. I appreciate that.
Yeah, absolutely. All right. So we've talked about cancer care. We've talked about the academics. I'd love to dive in a little bit around the strides that you all have made on heart and vascular care. What initiatives are currently underway, and what are the health needs in the community around heart and vascular?
Yeah, that's a good question. Right now, heart disease is the number one reason for mortality in the region and the state. And so that's a focus of ours. Fortunately for ECU Health and for Eastern North Carolina, we've got world renowned clinicians and here working in that space. And it's not uncommon for our clinicians in this space to be teaching some of the procedures and some of the cutting edge, how to use some of the cutting edge technology to other clinicians, not only in the country, but around the world. And when I say teach, in some cases, it can be done in a setting like this where we're doing it over WebEx, but in a lot of cases, it's actually there's people that are flying in from all over the world to learn how to do the things that are being done at ECU Health in heart and vascular. And so that service line, along with the cancer care service line, are two priorities for the health system. And the reason why they're priorities for the health system is because that's some of the highest burden of disease for Eastern North Carolina. And so there's a lot of focus on that. And we just actually, in fact, celebrated the 15-year anniversary of both the Heart Institutes on campus, for the clinical and academic collaboration. And so there's been a lot of collaboration between the university and the health system in this space. And we're currently raising dollars. We have what they call a hybrid operating room that utilizes the robotic surgery. And they probably do a little over 900 surgeries per year in that one operating room. And right now, a second hybrid OR is in the planning stages so that we can accommodate more of those robotic surgeries. And the robotic surgeries are proven they reduce risk of infection. The healing time is quicker, and overall it gives more of a positive outcome to the patients that are treated with that. And so there's a need to add another one of those. So we're working in that space right now with our heart and vascular team.
That's really interesting to hear on the studies with heart disease being the number one cause of mortality. Some of the most vulnerable patients are children across the state, right? And so the Maynard Children's Hospital is a great resource for families. Can you tell us more about what's going on with the Children's Hospital and the impact that you're making there?
Yeah, the Children's Hospital is like the other areas that we talked about, just a huge asset to this, not only this community, but for Eastern North Carolina. And back in the around the 2010 time period, before I was at the foundation embarked on a capital campaign to expand the Children's Hospital, and it later became the James and Connie Maynard Children's Hospital. And that expansion was raised around $22 million over a 4 or 5 year period. And if you ever get a chance to come east and tour any one of our facilities, they're all fascinating. The Children's Hospital was very thought out and very purposeful. And when kids are going through some of the things that they're going through, one of the things that can help them is that where they are doesn't feel like a hospital. And so there's an aquatic theme inside. And so they're to be distracted and be distracted by design. So it doesn't feel as clinical in that space to help them with their care. That facility is just remarkable. And one of the things that we've recently added to it, which I think your listeners would be interested to know, is a facility dog. And so we have a Maynard canine crew, which is designed to normalize the hospital environment for patients, sort of in the same way I just talked about it, through goal-oriented and purposeful interactions with our trained facility dog, whose name is Sam. And that's a new initiative for us, and one that has been very well received. And Sam is the dog's name, and their trainers do a really good job. We've recently done a playroom renovation in the James and Connie Maynard Children's Hospital, where we've renovated the playroom through funding sources, and those playrooms create a more welcoming and therapeutic environment for the children who need that type of emotional and psychological well-being in a very stressful time in their lives to deal with whatever it is that they're dealing with. We've also got we've just a new collaboration with the ECU baseball team. It's called Homers That Help. And so for every home run that's hit during the regular season of an ECU season, those funds help enhance the resources available to patients and families, providing comprehensive support during their stay. And so there's other things that go along with sometimes we just think about the child that's staying in the hospital, but the child comes with adults, and those adults need help with whatever it is that they need help with, and where they're staying and how long they're staying. And if there's a long drive from where they're coming from, then all that becomes burdensome. And so the partnership with ECU baseball has been really, really helpful from that perspective. And then the last thing I'll mention is just the expansion of our children's transport team. So we are expanding the transport team to make sure that there's timely and efficient transfers of the pediatric and the neonatal patients, enhancing the access to critical care when needed. And so there's at the Children's Hospital is sort of the same model as the cancer model, whereas the James and Connie Maynard Children's Hospital that's the hub, and then there's spokes, and there's certain times and situations and things that happen where it's very important that a child gets to the James and Connie Maynard Children's Hospital very quickly. And so we've got those things in place, but making sure that they're enhanced and that we've got the more of or better of those things are something that's important to us, and something that our funds are going towards at the moment, what we're currently raising dollars for.
Yeah. Yeah, I love that. I love that there's a lot going on with the children's hospital, it sounds like, and it sounds like Sam will bring some joy, right?
Mhm.
When maybe there's not a lot of joy going on. So I love that that's a creative and outside of the box way of just trying to comfort those kids during a time of need. And even with like what you said with the baseball team, how that if I was a player, that would certainly motivate me to want to get a home run so I could help, the families that are staying there. So that's really great.
Yeah, I think I want to add one thing about what you mentioned about the baseball players too. I think it goes back to what I talked about earlier about the people in this area just being passionate about the university and the health system and wanting to make it better and understanding its purpose. And the baseball team initiative it was started, and the idea came up from a baseball player. So they approached us. So they're in their they had a desire to want to help, and they came up with the idea. And so I think that goes to show you exactly what I was talking about earlier about people just have an innate desire to help within the healthcare space and the higher education space. And so that working with people like that makes our jobs a lot easier because they're already willing to put their time and energy into making something very positive happen for one of the institutions.
Yeah. No, that's incredible. That's amazing. I love hearing that. So now let's dive in a little bit deeper with the regional partnerships and the alignment across North Carolina. So ECU Health, you're certainly well versed in Eastern North Carolina, and then you mentioned Vidant earlier and the alignment that's there. Could you dive into the regional partnerships a little bit more and how Vidant comes into play as well?
Sure. So, the legacy Biden health system and the university, they've been partners for decades. And recently, about 3 years ago, with the creation of ECU Health, that alignment sort of tightened the partnership. And so the clinical operations of both the university and the legacy Biden practices are now aligning to make a seamless sort of experience for the patient. And so that has all been extremely positive. And what happens when you align is you're able to share resources easier. You're able to avoid redundancy and become more efficient. And so the institutions that were once partners are now just tighter partners, I think is the simplest way to form that. Although there's a lot of complexities that go into how it's going on, the vision is certainly there and has been well received. And it'll be a multi-year process to work through things that need to get worked through to get it to where everybody wants it to be. But underneath the sort of alignment of that created ECU Health, there was a desire to align philanthropy in the same sort of way. And so the Health Sciences Foundation Board and the Legacy Health System Foundation Board created an alignment that created the ECU Health Foundation, which created the Chief Philanthropy Officer role, which I talked about earlier, and then created the scope of work and our new purpose, which is to fundraise and support the health system and the health sciences units of ECU. And so when you talk about sort of the region, is sort of overnight what the legacy health system was once focused on from a fundraising perspective. The Legacy Health System Foundation was once focused on the 29 counties of Eastern North Carolina, and that's still an extreme focus of ours. But now, when we're working with the Health Sciences campus, there's our our scope or our geography or the coverage area now has broadened to the state of North Carolina because I'll just give you an example. The School of Dental Medicine has 8 community service learning centers around the state. They've got one in Ahoskie, Brunswick County, Elizabeth City, Davidson County, Lillington, Robeson County, Spruce Pine, and Silva. So that spans the entire state of North Carolina. And the way that they're set up is those centers are staffed by full and part-time faculty, residents, fourth-year students, hygienists, and others, and they provide dental care to an underserved population. And so before alignment, the Legacy Health System Foundation wouldn't have been involved in sort of the school with the School of Dental Medicine or these community service learning centers. Now, because of alignment, our interest now does span to those community service learning centers, and we actually have programs in place to help raise money to support those community service learning centers through the work on the health sciences portion of our model and through the work that we do with the School of Dental Medicine. So, and those types of centers require partnerships. They require community partnerships in each of those areas to make sure that those community service learning centers are doing what they need to do and then are well received and people understand how to access them and how to use them and those types of things. And so to your point, the alignment has not only been extremely positive for Greenville in Eastern North Carolina, but it's given us a different perspective on the entire state and how the dollars that we're raising and the donors who are supporting us have impact on more than just Eastern North Carolina, and and for that matter, the state of North Carolina now in some cases, depending on what they support.
Yeah, Scott, that seems you're making a big impact across the state. So congratulations. I mean, that's huge. And I'm glad to hear that the alignment is allowing that broader net to be cast and reach the communities of need across the state, not just in one region. So that's wonderful.
Thank you.
Yeah. So you talked about community involvement. Let's talk about business involvement a little bit and business community involvement in particular. So how can the business community help support all of the initiatives that ECU Health Foundation is doing? And how could the business community also help you meet and achieve your goals from the foundation?
Yeah, it's a really good question. And we work with a lot of businesses around Eastern North Carolina and through the state of North Carolina. And it's just a matter, those businesses have interests. And if those interests are revolve around the improvement and supporting the health and education well-being of the people in Eastern North Carolina, then a quick visit to our website to see what those options are, and take a look at the communication vehicles that are available on our website, and then we would welcome the chance to sit down and talk to them about how that they can support through whatever interest area that they want to take a look at. Some businesses sort of gather input from their team members on where support should go. Some make the decision sort of from an executive team that takes a look at things like that. And we've been in settings where in all those settings and everything in between, but there is an opportunity for assistance in any of those in any area that a business would be interested in. And so it's just a matter of reaching out to us, and then we do the listening and the learning, and then we can match those interest areas with opportunities that we have at the health system or the health sciences campus or both.
Yeah. And I would encourage all of our listeners, right? If you're in the business community, if you can support ECU Health, it would go a long way. And Scott, I want to mention something. When you and I did our pre-recording session, you mentioned that if you were to start in a community and the community didn't have anything, right? You're starting from scratch. 2 areas of focus for supporting your community would be to support healthcare and education. And those are 2 areas that ECU Health is committed to helping make a difference. So I think that would go a long way for businesses to really invest in both of those.
Yeah, I think that I think that's exactly right. There's sort of what we've come across through just the years of fundraising and talking to people is that either a donor or a business has some sort of attachment to either the health system or the university because they've used it or attended it. And so they sort of had the experience, and that experience has then led to them being really interested in it. And then when you're really interested in something, you want to support it. And then when you want to support something, you can volunteer, which we have opportunities, or you invest in it. And so the investment in our case would be a donation. And so there's that piece of it. And then there's those people that we talk to that have not used either facility or either institution, but they understand its importance from an economic development standpoint. And to your point, if you are starting a community from scratch, one of the two things that you should consider probably to make it an economically viable area over time would be a health care mechanism of some sort, and then an education mechanism of another. And so we've got both of those here. And so just from if you live in the area and you are benefit from its economic viability and the success that this region has had over time, you can tie back a lot of the success to the university and to the health system. And so, just through that lens, there may be a desire to sort of support the institutions, and then we can help sort of talk how you would want to do that based on the specific interest that you have within each.
So before we wrap up, I've got some few outlook and prediction questions that I'd love to ask you. So can you tell me a little bit what's on the horizon with the ECU Health Foundation in terms of new development initiatives that you're taking on, or anything that'll make a significant impact to the region?
Yeah, so the one thing would be the continued work on alignment, and the partnership between the university and the health system, which we talked about. So that will be something that we'll continue on. And then we've got some exciting initiatives that are coming up. One in particular that I can mention today is the Center for Medical Education. So essentially a new and expanded medical school. So right now, the Brody School of Medicine graduates roughly 90 doctors a year, mostly in primary care. And this facility, in addition to updating just the technological capabilities to more of today's standard of a medical school, will also increase the class size. So it should increase the class size over time to roughly 120 doctors a year, which is important because what we talked about earlier, Valerie, was there's a shortage in primary care physicians, and so that's one of the ways in which we can help with that, right? So it can admit more students, which then graduate more students, and so that building will help us do that. So we're looking at initiatives to fundraise for that facility. And then the other is what we touched on earlier is the workforce development piece of it. And so how can we continue to use our philanthropic dollars to support the scholarship aspect of the health sciences campus and those students that are attending the units on that campus, and then how from a recruitment standpoint we can continue to have the packages that keep those residents and those students in Eastern North Carolina and practicing in Eastern North Carolina. How can we support the research that our clinicians are doing to help with preventative measures to help keep people healthier? And so dollars that are going to be focused on that. Between those two, those would be the two immediate focus areas that would be sort of in addition to what we talked about. But we will always fundraise for cancer care and children's and heart and vascular. And we've got routine things set up and routine funds and mechanisms and strategy in place to keep funds available for those areas, in addition to the scholarships and the research and the faculty support at the university units as well.
Well, we certainly appreciate your your time today. This has been a lot of fun. I want to ask you one more question before we let you go. And because this is Constructing the Carolinas podcast, if there was anything that you would love to see be constructed in the state of North Carolina or Eastern North Carolina, what would that be? And it could be absolutely anything.
That's a great question. Can I give two answers?
Yes, you can.
Okay. One would be some sort of professional sports team, something that would be fun. That would be an interest of mine, personal interest. But probably more importantly, and one that's more related to what I do every day for crew, would be anything that we can do to improve the access to outpatient clinics for underserved communities. So any infrastructure upgrades, telehealth, mobile clinics, any enhancements to the school-based solutions, anything like that, because that's one of the largest challenges that we have as a institution is trying to figure that piece out. So if there's anything that we could think of that's innovative and cutting edge to help with that, I think that would be probably my first choice.
Yeah, two great answers. On the professional sports teams, we've had several guests come on and say they want to see Major League Baseball come to North Carolina. So fingers crossed.
Yeah, that would be great. I would be certainly in favor of that.
Well, we really appreciate your time today. This has been great. Thank you so much.
Valerie, thank you for the opportunity. Best of luck with future guests. This was a great job.
All right. Thank you so much, Scott Senatore. To learn more about ECU Health Foundation, visit ecuhealthfoundation.org. Thank you for listening or watching Constructing the Carolinas. We'll be back soon with a new episode, so be sure to press the follow button on your favorite podcast app or on YouTube. And check out what Barnhill is doing to construct the Carolinas. You can find us at barnhillcontracting.com, and you can follow us on LinkedIn as well. This podcast is edited and produced by Earfluence. I'm Valerie Bono, and as we construct the Carolinas and as we build this podcast, I encourage you to keep building and growing as well. See you next time.